Happy Monday, everybody. It's Dr. Matt with Full Potential Chiropractic with your Monday tip of the week. This week's video, we're going to go over the 5 most common issues that we have with our joints that I see in this office, and then we'll talk about the 5 different ways that we can help with the joint issues that are on our body. So number 1 being overuse. So let's talk about, right? So when I refer to joints, we're specifically thinking the shoulder, the wrist, the elbow, the knee, the ankle, whatever it is, right? There's a lot of joints in your body, but they also get overused quite a bit, just not by doing anything differently. It's just those common tasks that we do throughout the day, right? I call them activities of daily living, right? The chores are your common occurrences, and sometimes it's those different things we do as well, but most commonly it's the things that we're doing every day. The second one being stress. So if you guys have been to any of our workshops, there's 3 types of stress in our life. The physical, right? So there's 2 types of physical, the macro and the micro. The macro being car accidents, sports injuries, slips and falls, even birth trauma. And the micro being the habitual ones, typically our sleep, our sleeping posture, sitting, standing, being on our phones quite a bit. So the joints in our shoulders and our wrists and all that are definitely messed up, our work postures and all that. The other type of stress is mental emotional. Yes, mental emotional stress does have an impact on our joints as well. And then, of course, what we put into our bodies. So the medications, the food, and the drinks all impact our joints as well. So keep in line, the types of stress in your life. And it's not always, because the other things that I often hear is the age and the weather. Yes, they can play a part, but not as big as these other ones that I'm going to go into here in a second. So number 3 being muscle imbalances. So if there's a lot more tighter muscles across your spine and your body, it's going to pull in different places on those joints. So those joints are going to be, stressed on one side rather than the other. What about alignment issues, right? So if there's a problem in our spine, because everything is connected to your spine, if there's a problem in your spine, everything else is going to be compensated as well. And then last one, medical conditions, right? This is where we talk about the arthritis, the gout, the lupus, bursitis. When we have those underlying chronic conditions, it does take a toll on our joints as well. So what are 5 ways we can help out with this? So if you work out or you're doing your chores, it sounds silly, especially if you're doing your chores, but it does make a difference, warming up and cooling down. So if you're gonna, do some chores or whatever it is around the house, there's nothing wrong with doing a little bit of stretching, maybe applying some heat, just to get some blood flowing in that body before you start doing any type of activity. And then as well as, after you're done and that one spot's going to be sore the next day, throw some ice on it, right? That's just going to decrease the inflammation in that area. If you are big into working out or exercising, have a well-balanced exercise or routine throughout your day or your week, so you're not utilizing those same movements every day or every time you work out. The third being reducing inflammation. So we talk about the 3 stresses in our life, right? The physical stress, the mental stress, and the chemical stress. So when it comes to inflammation, it's brought up by stress. So anytime we can reduce any one of those types of stress in our life, it will also reduce that inflammation throughout your body as well. The 4th being adequate amounts of sleep and recovery. So making sure that you are getting the allowed amount of time for rest. Now that's always the big question. I've answered several times in these videos. It's how much sleep should I get? Well, that's really all dependent on you, right? You know your body better than anybody else. For me to tell you that you need 6 to 8 hours of sleep would be wrong with me, right? There's a lot of people that can do very well with 6 hours, some 5, some need 8 or 9. It's a matter of deep sleep, not the length of sleep, but the quality of sleep, remember. And the last one, of course, is chiropractic adjustments, helping out with your alignment. A lot of time in this office, people come in with wrist and shoulder, knee issues, ankle issues, and we focus on the chiropractic adjustment strictly to the spine for the first 12 adjustments. And what I see a lot of the time is it starts to clear out a lot of those issues that we have on the joints as well. So getting everything balanced back out. Now you can have organic issues a lot of the time. in the shoulder, the wrist, if there's some old injuries that have healed in wrong, yeah, we can take care of those as well. We typically do it on the 13th adjustment. Just want to make sure it's not part or issue of the spine, right? Because remember, your nervous system controls everything. And once you get your spine in alignment, it allows your brain and your body to talk more efficiently. So if we start to clear out that, it also starts to heal up those areas in the other spots as well. So hopefully this helps. If you guys have any questions on this, post them below, email us, text us, call us in, set up a free consult if you have any questions. Have a great day, everyone.